Hello, my name is Rachel Roesch. I'm a junior in the Operations Research and Financial Engineering Department. And this summer through PICS, I interned at the Children's Hospital of Philadelphia in their Business and Strategy Innovation Department. So a little introduction on what Children's Hospital or CHOP's mission is. Basically, they are one of the leading pediatric hospitals in the nation and even in the world for certain programs. And their ultimate goal is really to advance healthcare for children and expand the best possible resources to patients for care. Through this internship, I was really hoping to get a look into the healthcare industry and seeing if it's possibly an avenue that I'd like to explore for my career. So I'm primarily interested in data analysis, and I like those analytical skills. And really, I just wanted to figure out if this was a field that I could see myself applying those skills for. So my actual work at the organization was with a group called Frontier Programs. And Frontier Programs is a group of clinical trial research-based programs specializing in diseases and rare conditions that were really pushing the envelope on cutting-edge clinical care for pediatric patients. It was really exciting to learn about all of the work that they're doing, especially as someone not involved directly in the medical field, but on a more operations and business side of things. And my specific project was to work on a growth strategy for the programs. So I worked primarily with one program, analyzing data, going through an internal review process to figure out where our patients were coming from, where we can target to expand for patient care, what the intake process looked like, and if there were any inefficiencies along the way or a market that we weren't getting, and really pinpointing those areas to improve so that we could reach out and expand patient care. And I really enjoyed the internship for the reasons that I mentioned. I was hoping to get out of it, in that I applied my analytical skills and could see a direct impact that it was making on these programs, on the hospital, on children all over the world who seek treatment at CHOP. So after actually performing the analyses, I presented my findings to different clinicians at the hospital. And that really was to initiate a discussion on areas that they see that we could improve in, and if those aligned with the areas that myself and my supervisor were identifying. So coming from my data and also those discussions, followed up with different programs across CHOP, including the National Provider Engagement Team, Global Medicine, as well as marketing, again, to really expand patient care into the target areas that I identified through my analyses. And that was pretty much it. So after my 10 weeks, that strategy that we identified, all of those analyses, the target areas, where CHOP is hoping to implement across all of their Frontier programs. So mine was more of a test pilot, and then hoping to expand it to all of the different clinical research programs. So my summer going forward, based on my experiences at CHOP, I really liked the idea of applying my skills and my interests to healthcare and knowing that it is making a direct positive impact on people. So I'm considering looking even further in depth into healthcare and going into a more niche operations role to really understand how hospitals operate and the different things that are required there and any inefficiencies that can be improved within the system as a whole. I think it's a really interesting time to be looking into healthcare with COVID-19, as well as all of the racial inequality and injustices that are prevalent in the healthcare system. So I think it's a really important field, and one that I can see drastically changing in the future, and hopefully for the better. So it'd be very, very exciting to be a part of that change. And also exploring other avenues in which I can make meaningful contributions to organizations. So throughout the internship, I think I was really pushed out of my comfort zone as a student who doesn't study anything medicine related. Picking up the lingo, all of that was a bit of a challenge, and CHOP is a very fast-paced environment, which makes it exciting and dynamic, but it was also a little difficult to adjust at first. But coming out of it, I think that I really gained some self-confidence. I think my communication skills improved, my presentation skills also improved, and also just my critical thinking and kind of the process in which I view like hospital operations and how to think logically about target audiences and different marketing strategies. So I was very much exposed to the healthcare industry from a business perspective, which is what I was hoping to get out of the internship in the first place. So I really enjoyed the internship, and I would just like to thank everyone for a final time who was involved in allowing me to do so. So thank you to CHOP, thank you to the Center for Health and Wellbeing. Thank you for my supervisor, thank you for my PICS mentor, and thank you for everyone else who was involved in funding, like my donor, and who supported me along the way. Thank you.